much. And thank you for confirming that we do indeed have a quorum of the Strategy Committee of Access Health Connecticut. And I hereby call the Wednesday, February 11, 2026 meeting to order. Marcin, could you do a roll call, please?
Mr. Chair, before I do the roll call, I will just make a quick note that this meeting is being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live-streamed on the Access Health CT website. Roll call for attendance. Steven Hernandez, Chair.
Present. Thank you.
Thank you. Graham Ritter.
Here.
Thank you. Paul Philpott. Tricia DeVay.
Here.
Thank you. Matthew Brackman. And Kathleen Holt.
I'm here. Thank you.
Thank you. We do have a quorum, Mr. Chair. Thank you.
That's great. Thank you, Marcin. And if you could the members of the Access Health Connecticut senior leadership team please introduce themselves as well?
Good afternoon, all. James Michel, Access Health Connecticut.
Gina Walsh, Director of Operations, Access Health Connecticut.
Good afternoon, Susan Rich Bai, Director of Legal and Governmental Affairs, Access Health Connecticut.
Good afternoon, everybody. John Carbone, Director of Small Group Product Development and Broker Support.
Good afternoon, folks. I'm Glenn Jurgen, Access Health Connecticut, Director of Human Resources.
That's great.
Good afternoon, Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
Mr. Chair, I believe that concludes the senior leadership team introductions.
Thank you. Thank you, and thank you for those introductions. Marcin, am I correct that there was no public comment for today's meeting?
That's correct, Mr. Chair.
Okay, great. So I think we should get to the first order of business. I know that the minutes from our previous meeting were circulated, and I'm wondering if we could entertain a motion to approve the September 11, 2025 Strategy Committee meeting minutes.
Yes. Hi, this is Grant. Motion to approve.
Thank you. Can we have a second?
And I'll second Kathy Holt.
Thank you, Kathy. Could we have a roll call vote?
Mr. Chair, is there any discussion on the motion?
Any discussion? Any discussion? Hearing none, Marcin, I think we can proceed.
Yes, Mr. Chair. Steven Hernandez.
Yes.
Graham Ritter.
Yes.
Paul Philpott. Tricia DeVay.
Yes.
Thank you. Matthew Brackman and Kathleen Holt.
Yes.
Thank you. Motion passes.
Great. If we could move to the next part of our agenda, I'm excited to hear the Broker Academy update.
All right. Good afternoon, everyone. Tammy Hendricks, Director of Health Equity and Outreach. I have the pleasure of starting our meeting with a Broker Academy update. We are really excited to be heading into our 5th year of the program. Time really flies when you're having fun. Last year, we had such a successful program with our graduates. We had a smaller class, but a much higher passing rate for the state exam. So we're sticking to that winning formula and timeline as last year, hoping to repeat the successful year. So the application timeline for this year is similar to last. The application will open up March 2nd, 2026, and then the application will close at the end of the month on the 31st. We are going to hold information sessions as we typically do. We have 4 planned, but community partners often request for us to join their meetings or talk to their groups. So we have some of those events planned in between as well. And it's really a great opportunity for us to meet with some prospective students, answer their questions, and tell them about the program. So we have a lot of those events planned as well. And we're getting a lot of interest. We opened up the form on the website about 2 weeks ago, and we have over 50 leads already. So a lot of word of mouth promotions from our community partners and previous students. So we are going to see those numbers increase as we go along as well. And as always, our community engagement plan is in place. We have outreach to our community partners, our navigators, and they're helping us spread the
Good.
word
I'm
here.
I'm in the middle of a strategy meeting, but can I just wanted to
John.
call you in and
John, you're
John.
on. Mute yourself.
sorry.
And so we are also promoting the program as usual at all of our events, and we're reaching out to those applicants that have previously applied, didn't get to do the program, et cetera. So we have that plan in place, and we are going through that. This year for the class locations, we are targeting the Hartford and New Haven areas for a few reasons. We've checked out some website analytics, and we have some strong engagement in the Hartford area, of course, but New Haven was a second runner-up. We also have spoken to previous students and our community partners, so we seem to have a lot of interest, again, in the Hartford and New Haven area. So we are trying to lock in some locations for that. And then finally, for the program timeline, it'll be the same as last year. We have virtual trainings for the students. We have weekly meetings set up for them starting in May, making sure that we keep them engaged through the trainings and also track their progress. And we meet with them and answer all their questions. And it's also an opportunity for us to introduce the students to Access Health staff and our teams and some of the mentors that have participated in the program in previous years. And then after the virtual training, we have the in-person classes, and that's been very important for students in previous years. So we'll continue that. And that is slated for June 13th and 14th. So then they take the state exam, continue on with the mentorship portion of the program to finish out. So very similar to previous years to that end, but we are expecting another successful year, and we're really excited about it. So I'll pause here if you have any questions.
Mr. Chairman, very quickly, hey John, can you give the committee a quick update on how we are using some of the students this year, and in light of what's going on with broker commissions, and how we're going to use 2 of them for throughout the entire year?
Absolutely.
That's
I can
great.
give you a quick overview right now. It was part of our presentation, but I can do it right now at this moment. So in the beginning of the year before open enrollment, we felt with all the changing in the commission's environment here at Access in the state of Connecticut with Anthem and Connecticut, Anthem lowered their commissions down from $18 down to $10. And for Molina, they eliminated commissions on new business and only kept renewal business in place. So we felt like as an organization that we wanted to make sure the 40% of our population who is not assigned to a broker may have access to one to discuss their options and all that. We developed a program in-house that we hired 8 contracted brokers during the open enrollment season to help out those individuals, go through plan options, be able to ask the questions that you wouldn't be able to get from a call center that you needed to get from a licensed broker. And they helped over hundreds of individuals. I think the final number was a little over 500 and change. I think it was 545 individual members through the open enroll process, but there were more that they were able to build relationships with too. We are also going to carry those 2 of the 8 throughout the whole year. They're going to help with our Business Plus platform, individual special open enrollment session, and they're also going to help us out with helping individual members understand their plans and set up primary care doctor's appointments if they choose to, or make them aware that they can do that. So really excited about what's going to be happening in the future with that.
That's great. Thank you.
You're welcome.
Anything further on the Broker Academy? Any other questions? This is such a hallmark program of Access Health Connecticut, and it's wonderful to see how over time it is enriching so many that go through the program, and you're building a great alumni network. So thank you so much for all the work here.
Thank you much.
Thank you for your
Appreciate the comments.
Yeah. Next, we have our strategic project update. Is that right?
Yes, Mr. Chairman, very quickly, before I turn it over to Katie to give you an update on the 10 Clicks project, I just want to, again, thank you for your leadership and thank you for this committee. Because if you remember about a year and a half ago, maybe we introduced the 10 Clicks project, and this is a complete update, but not update, a complete new platform we are seeking to develop to replace our current platform, which we have not touched since we went live 13 years ago. So imagine the advancements in technology since then. And then our system is still the same. So if you came into Access Health back on October 1st, 2013, come back today, you have the exact same experience. And think about if you bought something on Amazon 13 years ago and you buy something today, how much advancement Amazon and other websites have gone through to help customers purchase items much faster, much clearer. Our system still has changed, and we know it takes too long to go through the process. I think last time we counted it about 100 and over 150 clicks to get through the entire application process. So a lot of folks who are hourly workers and who do this on their lunchtime, they just would not have time doing they're doing a 30-minute lunch to get through the application process. So that's why we think 10 clicks, it's an aspirational goal to get everything done by 10 clicks. We think again, if we get the application process down below 20 minutes, I think there are a lot of folks out there who currently do not have health insurance because the process is too long and too complicated. In the new environment, it'll be more efficient, shorter, and clearer. We built our current system back in 2012, 2013, as the rules were being written by CMS. So now we know what the rules are. Everything's been clear. We have a lot more information about our customers, who they are, how they like to shop, and we have a lot of our employees contributed to where we are to what we're trying to develop now. Our brokers contributed to the information that we use to develop the 10 Clicks project. So we think that once it's up and running, we believe that it'll be more efficient and easier, clearer application process. Connecticut residents would go through, make it a lot easier for them to buy insurance through the exchange. And also, if we have to make any changes to the system, we could do it a lot faster. Right now, we have to pay one of our vendors a ton of money to make simple changes to our system because system is just one big box, everything's connected. So in a new environment, it'll be more modular and a lot easier to move it a lot quicker. So with that background, Katie's gonna give you an update where we are, what we've done so far, where we are today, more importantly, where we're going in the future. Thank you.
Thank you for that, James. And I'm wondering, there are agile processes that you can use to keep systems fresh over time. And I wonder if that's the intent now, right? To have the
going
system
forward
continue. That's great. That's wonderful.
Yes. And in the current environment, we cannot do that because how the system is designed.
Right.
Agile
Point in time.
Yeah, exactly. Thank you.
That's great. Thank you for that, James.
Go ahead, Katie.
Thank you, James. Thank you, Mr. Chair. Good afternoon. My name is Katie Hearn. I'm the Associate Director of the Enterprise Project Management Office at Access Health, and I'm giving an update today on the 10 Clicks project on behalf of IT Director Marquise Davis, who is the project lead. We are currently wrapping up our vendor oral presentations this week, and we will have heard 4 oral presentations from vendors. The proposal evaluation team will finish their evaluation scoring this month. And the vendor recommendation will also be made by the end of this month. After that, we will then enter the procurement and contracting phase. It'll be led by our legal department by March. And we expect a vendor to be selected by April and the project team to begin work with the vendor by no later than May. So we're making good progress. We have identified stakeholders who will play integral roles as members of the project team for the implementation phase when the work with the vendor gets underway. And we will also need to continue to work very closely with our DSS counterparts to leverage their subject matter expertise for the modernization of our integrated eligibility and enrollment system. We look forward to having the new application launched before open enrollment 15 in 2027. That would be for the 2028 qualified health plan policy year. Finally, we are currently targeting the go live of the new software application for June of 2027. That's our current target. And I will pause for questions here.
Are there any questions on the project? Any other observations?
The only
That's
thing I
great.
would
Thank you
add,
for that
Mr.
wonderful
Chairman,
update.
is that we
Yep.
have 4 vendors that we are very happy with, and 2 of them we know intimately, and the other 2 are new to us. But they're all 4 are very qualified to do the job we're looking to do. We're just trying to pick the best one to give us a product that we're going to need, as Katie indicated, on June 2027, so that the experience for our customers with the open enrollment starting on November 1st, 2027, will be dramatically improved. Some of the challenges that we have to be aware of is the change. We have customers who've been using our system since 2013. So it's going to look and feel different to them. So we got to be mindful of that. But also our own employees who use our system to service our customers and our call center vendors. So we have a massive change management program in place to start preparing the staff and our partners for the changes that are coming. Again, those are part of the, not core to the project, but extremely important for the project to be successful.
Thank you, James.
So again, good afternoon. John Carbone, Director of Small Group Product Development and Broker Support. I want to give you a quick update of where we are with Business Plus, Individual Coverage Health Reimbursement Arrangement. We've gone through our first open enrollment. We're excited to inform everybody we have a little over 775 quotes that are sitting in our system right now throughout the whole year for businesses quoting throughout the whole entire year with different effective dates for July and August. And we're evaluating all those with those brokers and going through the education process with them and their employers. For January, we enrolled 33 groups, a little over 313 members, a little below our target number of 416. We were at 75% of our goal. Our goal throughout the entire year this year is to enroll 5,000 members. We feel that we still are going to be on track, and we're going to continue to make up those numbers and continue to move forward. We're continuing to we're continuing to improve our platform with our feedback from our employers, our brokers, and the employees. We have made multiple revisions regarding our quoting tool to make sure that we get the information, and we're continuing to do training with our broker community. We have trained over 455 brokers on the Business Plus platform, and we're excited to continue to do more trainings. We actually are going to start holding some webinars and also start doing a lot more chamber meetings and association meetings. We were at the non-for-profit conference here in Hartford this year. We were really excited about the traction we were able to make at that event and be able to share all the feedback, all the information with that community of non-for-profits. Our focus is still in this region. We are coming out with some new marketing campaign also in the next week or so, which you'll see a lot more visual and a lot more in-person meetings as we've kind of come out of open enrollment. I'll stop there and see if anybody has any questions. Okay, I'll move on to the next thing, our SHOP, our small business platform. We are looking to take our small business platform and integrate it into our ICHRA platform. That gives us the flexibility of allowing a broker to look at both options at the same time in the same platform with the same quoting tool. We are in the process of kind of putting all that vision together, working with our internal team that is managed with several individuals managed by our EPMO team. And we are hoping to kind of have a vision and everything implemented by this August. Stay tuned. That is more just for Synergy to create a seamless a vision and a journey for the brokers and the employers. So more to come on that. And we already spoke about the broker strategy today. I do want to make a slight correction. I stated that Connecticut's commissions was $0. It's actually $1. So it is not 0. So they do pay $1 in commission, but I want to make sure that I clear that. So,
John, to be fair, it was 0 until we pointed out to them that it cannot be 0 if they're on the exchange. Then they bumped it up to $1 to meet the letter of the requirements.
It's not 0, but it is $1. So I just wanted to be clear with that too.
Again, for both renewals and new business.
No, renewals is 18.
I said $18. Okay.
Yes, sir.
So,
yes.
So the reason we created our own little broker support organization. By the way, they're not our employees; they're contractors to us. The 8 brokers that John talked about. So because brokers, they're not going to bring new business in for $1. So we think that a lot of them would not do the work. And so if somebody call a broker and the broker is not responding, they have an option. They could call us, or our call center could refer them to our brokers, because we are paying them a contracted rate. They will pick them. They will service them and help them pick the best plan for themselves and their families.
Thank you for that. Thank you for that clarification. Mm-hmm.
You're welcome,
Thank you,
sir.
John.
Thank you, everybody.
Great. And now we have Susan Ridgeby.
Good afternoon, everybody. So we have a topic that we've been talking about a lot, but with some updates here. As you know, the enhanced premium tax credits did expire at the end of 2025. And though there had been, activity in the House, nothing has come up and gotten passed in the Senate. So nothing has been done on the federal level with an extension. So what does this mean? Consumers with income over 400% of the federal poverty level, unfortunately, were no longer eligible for federal subsidies. And then consumers with income between 100 and 400% of the FPL still are eligible for federal subsidies, but it went back to the original ACA contribution percentages, which are less rich than what has been in place since 2021. We also had an interesting phenomenon here in Connecticut because some of our silver premiums, went up so much. It actually muted the impact for a lot of our consumers that were still eligible for federal subsidies. So that was actually turned out to be a strange good thing. If you go to the next slide, Marcin. Thank you. So what else has happened? Governor Lamont, has always been focused on Connecticut residents and maintaining affordability for them. So he stepped in last fall in a special session. The legislature put $500 million into a special fund to make up funding gaps caused by federal changes. And this was one of them that he chose to fund from that money. And so it is called the 2026 Temporary Premium Assistance. And two income groups were selected for this based on data that we had provided to the governor. So consumers with income at 100% up to 200% of the FPL who are not in covered Connecticut are receiving temporary premium assistance from the state to put them back up to what they would have gotten with the enhanced premium tax credit amounts. And then for consumers with income over 400% and up to 500%, who, as I just mentioned, completely lost any federal subsidy, the state is making up half of what they would have received in an enhanced premium tax credit amount. So we have just, we've been working with the state on this for many weeks, and we put our process in place. So the manual part of the program has started, and the system changes will go in I think the 3rd week of March. But consumers who are eligible now, that information is flowing from Access Health to the carriers, and then the carriers will be crediting consumers with these amounts. Did I have one more slide, Marcin, or no? Or was that the last slide? I forget. Nope, I did. Thank you. So in the interest of making sure that as many consumers as possible can take advantage of this, we've done several different things. Back in January, we extended the open enrollment period to the end of January, January 31st. And in that time period, we mailed letters to almost 40,000 consumers that may have been eligible and needed to take some action or maybe weren't enrolled for 2026. So we did a very big mailing campaign to get the word out on this, and we have a lot of information up on our website. And then, as I mentioned, the manual phase began, and we also have created a special enrollment period that started this month, February 1st, and will go sometime either in late March or early April till the system enhancements go in, so that as many consumers who are eligible can, find out the amounts and take advantage of this. So we're doing everything we can. We're going to do another direct mailing campaign in the coming weeks too, just to make sure that the word is really out there for folks. So I will pause for any questions.
Susan, can we share with some of the enrollment numbers we have so far? I know, yeah.
Sure. I don't know if I have the exact numbers in front of us, but like I mentioned, because the changes in silver premiums actually resulted in, healthy subsidies for those that were still eligible for federal subsidies. We have seen very robust enrollment this open enrollment period. I think there's about between 6,000 and 9,000 consumers who may be eligible for these subsidies who were enrolled in 2025 but have not yet enrolled for 2026. We've been tracking that, and I think we've been sharing those numbers with the board. So that is kind of the audience that we're, focusing on. Were those the numbers, James, you were looking at?
No, the numbers who have actually enrolled. Do you have that?
I think we have about 157,000 folks enrolled.
No, I'm talking about.
Oh, that are getting the premium assistance?
Right, the TPA, yes.
I'd have to go back.
I know Rebecca sent it out a couple days ago. I'm trying to pull it up now.
Yeah, I'm trying to look. We had larger numbers of folks in the 100 to 200% category, and a smaller number in the 400 to 500. But I will try to pull that up.
No,
sorry,
Susan,
James.
I have it in front of me.
You have
now.
it? Okay.
So
yeah, I got this is Trisha DeVay. I got an email today on the enrollment stats. Is that what you're talking about?
No,
that is just generally, Trisha. That one doesn't have the numbers James wants to mention.
Right. No,
Okay,
this one specifically for the temporary premium assistant program. This was as of this was as of let me see, last Friday. The 100 to 200 cohort, January, February, March, and April total is about 22,000. Right? Again, they're already benefiting from this program. They're 400 to 500%. We have, let's see, we have 2, 4, 6, 8, about 9,000. So about 30,000 folks are benefiting from the governor's temporary premium assistance program. And again, we're just getting started. And those folks, they are currently receiving this benefit.
Yeah, so the carriers will be sending them updated premium bills. We're sending out notices to let people know the exact amounts, for those that have already been determined eligible through the system. And then the carriers will be sending updated premium bills and applying credits for people who may have had coverage that started in January or February and already paid a premium bill. So they will be credited for all of those amounts, going forward. And then the money is being paid directly to the carriers.
This is good news, but there's a lot at stake, right? Because we don't know. There's a lot of uncertainty as we move into the future. So what are your thoughts about just how we continue to send a message here about just the incredible impact, not only that this assistance is having, but for the assistance, there'd be a lot of people that would be suffering right now.
So, Mr. Chair, our superpower is communication.
Yeah.
It's continuous communication. We use all platforms. We do direct mails, we do email, we do text, our website, and we leverage digital marketing. So anywhere that we can, we do very targeted marketing because we have a lot of data about our customers, and we do a lot of internet-based marketing targeting certain groups based on the data that we have. So that's how we continue to do it. But we've also done press release, and we share a lot of information with the board in the state legislature. Hopefully, I know I think this is a 2-year commitment, I believe, Susan, if that's correct.
It's a 1-year commitment for those two groups, but they've also, the state has increased costs for Covered Connecticut because of the reduction in the enhanced subsidies. And those amounts that they've allocated from the special fund go through June of 2027, I believe.
And Mr. Chairman, we also work very closely with DC delegation, all 7 of them, the 2 senators and the 5 elected House reps. And we spend a lot of time sharing a lot of information with them. And we share it with all 7. Sometimes they reach out to us, we reach out to them. But it's a continuous communication with us and them. And then my understanding is that they are working hard to with their colleagues to get some version of the enhanced subsidies restored. We don't know if it's going to be the entire amount or a portion, but we believe something is going to happen. We just don't know when or how much. I hope that.
Well, thank you both for this.
Okay. I hope that answered the question you asked.
Yeah, absolutely, yes.
And then just a brief update on the Health Plan Benefits and Qualifications Advisory Committee. As you hopefully or may know, this is the advisory committee that works closely with us to make recommendations to the board for the QHP certification requirements each year, primarily the standard plan designs that get approved. Unfortunately, the committee's work is a little behind because we are still waiting for the federal AB calculator to come out. That is a very necessary tool for our work. We did have our first meeting. We had mentioned that to the board in January, and we are figuring out scheduling dates for the next meetings as soon as we find out when the calculator is coming out, because the carriers and Wakely, our outside actuaries, all need that tool to see where we are with the plan designs. But we will, work as hard as we can. And obviously the focus, as we've been talking about, and James has been mentioning, and a big focus is on affordability. What can we do? Is there anything we can do with plan designs to help on affordability while still providing comprehensive coverage as well?
Susan, can you talk about the timeline in terms of getting approvals, when the dominoes start falling with the insurance department and so forth?
Yes, and we have Trisha DeVay on here for this now. Okay. So yeah, that is a challenge. The date that the carriers have to file their plan benefits and rates with the insurance department is June 1st, and we use the same date for their filings of their applications with us as well. So, these delays are condensing the time. Our goal is always to get the standard plan designs out as early as possible, usually in early March, to the carriers so that they have a good window of time to develop their plan designs and their rates before they have to file. And then everything, as James mentioned, is a domino effect going after that of the time that SID needs to do and Access Health needs to do for all of our work on the plan designs for 2027 to get everything ready for open enrollment in the fall. So it's going to be tricky, but we're going to do everything we can.
Great. Thank you, Susan, and thank you, James, for not only all the great work that you're doing. You know, in so many ways, there's a sense of urgency, but also a real importance in everything that you're doing, and the strategic work of Access Health Connecticut rises to the level of great importance right now as we move into through uncertain times. So, just really appreciating the governor's investment in the health of the people of the state. And unless there's anything further,
I think there's a question. I think Grant has his hands up.
Oh
Yeah. Hi, Susan.
Hey, Grant, go ahead.
Yeah. Could you say what the status of silver loading is for next year?
Thank you. That is a very good question. And that one ties to kind of what we were talking about the impact for this year of the increases in silver premium. There has been a lot of discussion and debate at the federal level about changing the way CSRs are funded and going back to the federal government funding them, which would potentially remove silver loading. And at the present time, I believe the insurance department uses a load in Connecticut between 10 and 12% for silver loading. So if this change does happen, that will have a big impact. It does lower silver premiums, but then it unfortunately also has a big impact on subsidies. So we are really closely watching that. That was an item that had been introduced for the One Big Beautiful Bill last summer, and Access Health was actually one of the entities that provided information to Congress on the impact to that. So they did not, because of the timing and everything else, they did not include it in that bill, but I know it's definitely something that folks at HHS are still, and the feds are still thinking about. So thanks for bringing that up, Grant.
Well, Grant, we don't think this is going to impact 2027, right, Susan?
We just don't know.
Yeah, we don't know.
We don't know. Last year, it was just too late in the process when they were doing the bill in, June and July, because rates had already been filed. So we're keeping a close eye on it, though.
Great.
Are there any other questions or observations? Great, hearing none. Again, thank you, James and the team. And thank you to my fellow committee members. We would entertain a motion to adjourn.
Yeah. Hi, this is Grant. Motion to adjourn.
Thank you, Grant. Is there a second?
I'll second Kathy Holt.
Thank you. And Marcin, could we have a roll call?
Yes, Mr. Chair, Steven Hernandez.
Yes.
Ron Ritter.
Yes.
Paul Philpott. Trisha DeVay.
Yes.
Thank you. Matthew Rockman and Kathleen Holt.
Yes.
Thank you. Motion passes.
Thank you, Marcin. And I will
Thank
note
you.
that our next meeting is April 9, 2026, and we'll see you then.
Thank you much, everyone. Bye-bye.
Take care. Bye-bye.